Our fourth speaker is Claire Kamp Dush, a professor of sociology and director of the Minnesota Population Center at the University of Minnesota. Claire, I will turn it over to you.
Thank you. Actually, I direct our development core at Minnesota. So if you ever want to talk about trying to get a grant, come talk to me because that's my job at Minnesota. So I'm going to be talking about an application of the IPUMS-CDOH that we worked on. And so when we first got our pilot grant, the budget didn't end up covering what we wanted to do. We weren't able to find other funds. So we worked with Sarah and John to rework our aims a little bit. So we worked on adding additional measures to the IPUMS-CDOH and also to filing some of our code in GitHub. So if you have any questions about that, feel free to reach out. And I'm going to be talking about one of the applications. The primary author on this work is a grad student, Alex Bates. He's incredible. In the Division of Epidemiology and Community Health at the University of Minnesota, will be graduating this year. And just if anyone's looking for an amazing public health PhD epidemiologist, he is awesome. So our major research questions here are, what is the impact of gender identity centrality, which we measure from folks in our study, community support, and then also from the IPUMS-CDOH, the state level policies on experiences of healthcare discrimination, and do these factors moderate the link between gender identity and healthcare discrimination? And so experiences of healthcare discrimination are common in LGBTQ plus communities. And by here, we're defining that as transgender and non-binary and cis sexual minority folks who are non-heterosexual. Also, I should mention that in this case, we are going to be looking within that community. In general, people that are transgender and non-binary report more experiences of healthcare discrimination than do people that are sexual minorities. Healthcare discrimination can lead to an avoidance of seeking out healthcare, and you don't want to necessarily go to the doctor or to your primary care provider or even a provider that would help you with your sexual health because of those experiences. So it's a serious concern. There's an increase at the same time in anti-LGBTQ plus rhetoric and attitudes in the United States. The ACLU has been tracking 515 anti-LGBTQ bills in the United States. You can look at their website. They'll tell you where they're at in the process of getting passing. So we were considering this in terms of how it's impacting people's perceptions of their healthcare discrimination experiences. So we're using the NCHAT. So again, it's the same data set that I talked about earlier. Here we're focused on the sexual and gender minority population in the study. I will talk about that in a second. For healthcare discrimination, we have a 5-item measure, and one of the examples is on here, but I actually wrote them all down. So some of the indicators are, I worry about being negatively judged. I worry when I go to this is like when seeking healthcare, I worry about being negatively judged. Healthcare providers don't take my concerns seriously. I worry that diagnoses of me and my health may be negatively affected because of who I am. And I worry that I might confirm negative stereotypes of people like me. Another item was I can trust healthcare providers to give me high quality care. So we had these 5 items and they were measured from 0 was strongly disagree to 4 strongly agree. For gender and sexual identity, we had a 2-step process for gender identity, and I'll make a little side note here that if you aren't interested in whether folks are cisgender or non-cisgender, it's not necessarily recommended that you measure transgender and non-binary gender identities, because for some people, they don't want to necessarily disclose that. So unless you actually need to know that, just throw it out there that you may not want to ask that question. But in this case, we were interested in variability related to that. So we have assigned gender at birth, and also we have people that can say what gender they are, and the choices were man, trans man, woman, trans woman, non-binary, and maybe something else. And I think there was an option to specify, and then they could go into another question that had other gender identities, including like two-spirit, for example. and then they could also write in. One thing important to note is that just because in the 5-point gender identity question where we ask people man or trans man, just because somebody's gender identity at birth was assigned woman and they're now identifying as a man, they did not necessarily choose trans man. So you can't make assumptions based on a direct question because they don't identify as a trans man now, they identify as a man now. So just throwing that out there that we use both the 2-step question as well as people's self-reported identities. If they chose trans man or trans woman, they're in this group. For sexual identity, we coded folks as heterosexual, straight, gay, lesbian, bisexual plus, and that included queer, pansexual, and omnisexual along with bisexual. And then they could choose another or multiple sexual identities. For gender identity centrality, there's a question, my gender or gender identity is a central part of my identity, that they rate from 0 to 4. For perceived community support, we talked about these a little bit yesterday. This is the question, is a city or area where you live a good place or not a good place to live? And we're choosing 2 of the items from the scale for people who are gay, lesbian, or bisexual, and for people who are transgender or non-binary, with some examples in there. I will say that when you look at the distribution of these 2 items, there's more people perceive more support for people that are gay, lesbian, and bisexual in their community than they do for people that are transgender or non-binary. In this case, these 2 items are averaged together. We also are using state level policies, and these policies I'm going to talk about now are available in the IPUMS-CDOH. So these come from the Movement Advancement Project. It is the state level policies. Protective policy, they code policies. If they're protective, they give them a positive value. If they're a harmful policy, they give them a negative value. And this, the way we got these data was using this thing called the Wayback Machine, where you can go back, and we chose these at the beginning of our study to capture the measurement of these items. And then we're getting ready to release some data from 2020 and backwards from the HRC, which is the Human Rights Campaign's Data Quality Index, and they track 23 distinct laws and policies, and we scored them in a similar way that the Movement for the Advancement of Progress scored them. And what you see here is the average of them, and then they were normalized. So here is sorry, am I like off? I might be looking at the wrong thing. Hopefully I'm getting this right. Okay, state level policies. So this is a map of states based on their scores of the Human Rights Campaign and the Movement Advancement Project. And so you can see some states have a very low policy environment, for example, Alabama, and other states, for example, California, have a much better policy environment for people that are LGBTQ+. So our outcome here is healthcare discrimination. The main predictor is that binary gender identity. The potential effect modifiers are gender identity centrality, community support, state level, and then we did weighted, nested, multi-level linear regression models. And then this is just to show you from all respondents, we chose people that were gender minority, and for cisgender folks, we chose people who are sexual minority. And then you couldn't be missing on the covariates, and we ended up with a sample of about 1,500 people. Weighted, the sample is 86% cisgender, sexual minority, 14% transgender, non-binary. You can see the percent for sexual identities there. Few people are heterosexual or straight. We have more people in the other sexual identity categories. 40% have a college degree, and the mean age is around 37. This is just a little reminder that just because somebody is transgender or non-binary, you don't necessarily know their sexual identity. So that's showing you, that's a little reminder of that. Okay, so in the bivariate analyses, transgender non-binary folks reported more healthcare discrimination and a higher gender identity centrality than our sexual minority folks. And then the sexual minority folks reported more community support for LGBTQ+. The transgender and the non-binary folks and the sexual minority folks both reported similar levels of state level LGBTQ+ policies. Well, they didn't actually report it, but they were in similar states. Okay. So here's our first set of results. So what you can see here is that at the bottom is gender identity centrality. And basically what we found is people that are transgender or non-binary, the higher gender identity centrality they had, the more perceived healthcare discrimination they had. And that was a significant modifier. We also found that for community support for LGBTQ+, if you perceived that your community was less supportive, then, or if you could perceive your community was more supportive, I should say, you were, for the sexual minorities, you reported less healthcare discrimination. But in this case, we actually found that they had higher reports of healthcare discrimination for people that are transgender and non-binary. So those same perceptions may not be as protective for those transgender and non-binary folks. And then finally, related to the state health, the state level of the policies coming from the IPUMS-CDOH, what you see is that at lower levels of support, transgender and non-binary folks have particularly higher instances of healthcare discrimination compared to people that are sexual minority and that are transgender and non-binary. And so just a few little minor things because I'm out of time. We may actually be underestimating these results because since we collected our data, the climates have gotten worse in several states. And we're also only looking at partners here who may, and so we don't have people that are single, so we may actually have an underestimate related to that in the broader community. And it was also during the pandemic, as we're all here talking about the pandemic. And just want to acknowledge our funding here and thank the consortium.